everybody knows who they are, and everybody washes their hands when they're there. And when they leave, they go back to their usual practice. And their usual practice is not terrible. No, we're doing terribly. Everywhere, every hospital in America, if you're lucky, runs about 50% hand hygiene compliant. When we send out our hand hygiene observers, the people who are supposed to be secret shoppers, but they come every month and sit on the unit for a month, for an hour, and mark down the hand hygiene for an hour, everybody knows who they are, and everybody washes their hands when they're there. And when they leave, they go back to their usual practice. And their usual practice is not terrible. I want to be clear about this. What we see is a nurse cleans their hands, they go in the room to give the patient a medication, and the patient says, I also need another pillow, and then they leave the room. They're still in the same care episode, but they leave the room, they touch a computer, they go in the supply room, they get a pillow, they bring it back, they go in the room, they get the patient settled, and then the patient says they want water, and they leave and they touch a bunch of things and they get water, and they've left fingerprints of the patient's bacteria and microbiome all over the unit. And then they go back in, they give the patient water, they're like, we're all good, then they wash their hands. But they've only been 30% compliant with what they were supposed to do for hand hygiene.